Hi, welcome to LSK121 Oral Prosthetics, which is dental laboratory. My name is Kahng, which is the owner of the company, and this is my initial over there. I'm doing this business over 31 years, and then I set up the business 25 years ago when I was young. A lot of people question regarding why dentists have to choosing LSK121. There's a reason. Let me explain number one, start one by one. Let me explain one, which is implant complex cases with aesthetic cases they usually send here, because we see differences between dentists, right? Because we fabricated so many prosthetic with the heart, and we care about the cases regardless implant site, regardless tissue height, regardless expanded whatever, regardless occlusions. We understood and they're better than anyone. Of course, his price is totally different. It's not higher extremely, but price differences. So you have to understand that, because so many doctors using the local laboratory, they used to it. But we fabricated, which is high-end, affordable prices, to me affordable. And then they can explain to the patient, they can share to my website, they can share to our social media platform, which is Facebook. I do have a lot of followers, YouTube. We made a lot of video, Instagram, LinkedIn, so many information over there. We got a lot of questions from the patients. At least it's 20 a month they require dentist. So dentists can talk to them together so they can share it, which is triangle, lab, technician, patient. We understood, and then they will get the final prosthetic. Back to implant. Implant is totally different animal, right? It's everybody does implant here and there, but we care about tissue, height of contour, occlusion, color, right? Shape and bite, those kind of things, and then longevity too. So we care, understand about the occlusion, and then when patient need the complex cases, partial, and the attachment, survey crown before they go to implants, and they need aesthetic, or 4 implant, 5 implant, 6 implant, along with occlusion. So we provided so many full mouth cases so far. So our product is a Citon series, which is 3,000, hybrid acrylic 4,000, about zirconia about 5,000, removable zirconia, Citon 7 star, which is top of the line. We provide the dentist so many cases. We publish the YouTube all the time. So implant with a complex case with the highest aesthetics, so you can share it. That's our lab. Okay, number 2, regarding cosmetics. So many people make the cosmetic, which is the O20, O30, B1, A1, right? All laboratory, over 6,000 laboratory in the United States, they provide the cosmetic cases all the time to the dentist. Our lab is differences, all right? So we not make the piano tooth. We know the form and design contour, especially golden proportion who need it. And also we created just a unique restoration from the patient's face, and then understanding occlusion, smile view, rest view, those kind of things through the internet. So we got a lot of communication between the patient and doctors, and then we give them the really good, just like a pearl aesthetics, just like the lifelike restorations. For example, if doctor said A1, we made it better than A1. If doctor said O20 exactly, we make it better than O20. If you need O20 exactly, that's not the lab you're looking for, because we not make the fake shade guide. The shade guide, you communicate it with the patient, 5 millimeter thickness, but we have a less than 1 millimeter thickness with the different materials. Regardless, different materials we fabricated, it's really good stuff, and they make just like collection. Okay, just we're trying to make the dentist collection. They can put it in the wall, and then they can discuss the patient. So we are really big at the cosmetic restorations. All right, number 3. So we fabricated custom shade guide than anyone. Okay, so I do have a background over 110 articles when I was young. I fabricated I made an article, individual article to the AAED, AACD, QDT, and so many journals I published regarding color matching. That's my background. Okay, so initially, a long time ago, I fabricated the natural teeth, and then I mimicked with the natural enamel, dentin and enamel, and then we fabricate with the paper, with laminated, and then we fabricated with all different color. So now it's available about this totally compact shade guide compared to bleaching color, okay, compared to the all different dentin and tissue, available about app soon. And that app relate with your patient, and then not only color, shape and contour, so all by digital. So you send it to our laboratory. So we fabricated specific the design and then color. We just make this jewelry. We just make the jewelry, just like better than diamond. We give it to the dentist. So dentist has a feel secure. So dentist receive it. So they deliver to the patient to maximize patient happy. So totally different than the commercial lab, and then our laboratory is totally different. It's not like commercial lab. It's made by Shade Tab with 5 millimeter, right? Composite tab, and then dentist order zirconia mono, which is not going to, it's not look like natural teeth. I know it looks like crown, right? High value, but we made a great product, just like the low minimum value, and then we relate with the natural aesthetic as possible shape and contour. We deliver it to the dentist. So that's the totally difference through our inventions, which is my passion. That's why using our laboratory, that's number 3 reasons. There's huge difference from either single crown, but I need a lot of documentations. 2 crown, 3 crowns, 4 crowns, 6 unit, full mouth rehab. So we all the time does the cosmetic related, and whoever has the full mouth cases, and then we can deliver it to better. Okay, number 4, the regarding full mouth cases. So rehab. It's, so many people could do rehab, but we do have a lot of diagnosis, wax up, treatment plan cases, and then we just see the one dentition, which is pre-op, and then increase the vertical dimension, and then increase the tooth size, and then all regarding movement we check compared to pre-op after we mount it from their preparations, which is baseball, everything. So we're building the good rehab cases to the dentist for the patient specifically before we go to the final restoration, either temporization, the dentist made it or we made it. So we give it to them, so we got good communication to make the 28 teeth, 26 teeth, 22 teeth. We just make all guidance, movements. That one we had a good background. Not only that, we're not yield about the strength, which is we utilize the zirconia, but we fully support the zirconia with specific area and then give them the maximum result for the rehab cases. That's our laboratory. That's why you choose it. So number 5, we fabricate the high-end removable the restoration, which is dentures, overdenture cases, partial, flex partial, is night guard. All those kinds of things we fabricated with the characteristics. Okay, so our laboratory, regardless the cases, even immediate denture, we give them as nice aesthetic as possible. It's not like the flat denture. Also, we can use denture teeth from Ivoclar or any good vendors. We can use it. That wasn't no problem. But we care about the all removable aesthetic. Looks like the tissue, looks like good set of the tissue, and all those kind all in-house here. That's why you can choose our laboratory. Also, night guard has the really good night guard with hard and soft. Even hard and soft, you can put it in the water so they can fit it all the time, adjustable fit. That was a great development as well through STL files. So we go to the all digital. So we made it the model from the we made a model from the all digital. So feel free to send the STL files so we can serve you as much as possible. All this I illustrated is specifically you have to using my laboratory. That's all I can guarantee for that. It's not only this, here's the bonus. When you have the cases, we document it from doctor pre-op, prep, if we need it, the cases, we documented the laboratory process. And then all put together, we can hand out to the dentist. so they can see, they can share all their social media pages, so they all the time use it because for the patient. And then we publish for you guys' name. So we put together all social media platform together. So I know the dentist has a little bit problem to find out the patient. I'm talking about good patients. So this is another your source for this is another source for the grab good people's marketing. And not only that, we can share about the professionalism. So we deliver to the best of the best. I've said I kind of arrogant, but the world best I'm trying to create it to my clients, no matter what they leave. So we deliver it to make maximum secure those kinds of things. I can deliver it. So that's why you can use LSK121. Thanks for watching, and then I hope you see your next cases. Appreciate it.